Welcome back. In today's video, we're going to be talking about Vilazodone or Viibryd, and this is in response to one of our viewers who asked us to make a video about this medication. If you would like us to make a video specifically for you, drop the video idea in the comments below and I'll be sure to make a video just for you. So in this video, we're going to cover the top 5 things that you need to know about Vilazodone or Viibryd. Starting with number 1, what is Vilazodone? Well, Vilazodone is an antidepressant, but it's not your typical antidepressant. You see, it's a serotonin modulator because it works as an SSRI, those selective serotonin reuptake inhibitors like sertraline and fluoxetine, and it also works as an partial serotonin agonist, just like that medication buspirone. So it's kind of like mixing buspirone with an SSRI. So then number 2 is, what is it used for? Well, it was FDA approved in 2011 to treat major depressive disorder. However, it has a lot of off-label uses such as generalized anxiety disorder, obsessive compulsive disorder, other anxiety disorders, and mixed anxiety with depression. And so number 3 is, how long does it take to work? Well, the thing about Vilazodone and one of its advantages is that because of that extra 5-HT1A partial agonism, it actually tends to work a lot more quickly than your other antidepressants. So typically within about a week, patients start to see results and they become accumulative. Within 2 to 4 weeks, you should really start to see the results of this medication. However, some patients may take up to 8 weeks at that max dose of 40 milligrams. So if it's not working after 8 weeks and you're on the 40 milligram dose, then you may want to switch to a different medication. However, please note that Vilazodone's absorption is dependent on whether or not you take it with food. And so it must be taken with food in order for it to be effective. And so what about number 4? Is this medication addicting? No. Vilazodone is not addicting and it doesn't cause dependence. It doesn't cause you to want to crave it and seek for more and more and more and more and ruin your whole life trying to find Vilazodone. It doesn't work that way. However, it may cause a abstinence syndrome because of that SSRI function of the medication. And so therefore, if you want to come off of Vilazodone, it's probably best to do so under the direction of your provider and just taper off of it slowly in order to avoid that abstinence syndrome, which you can actually get from other medications. It's not just singular to antidepressants. This can happen with medications like ibuprofen when you take those long-term every day. Anytime you're affecting your neurotransmitters or certain pathways, you risk, when you take the medication abruptly away, causing some sort of abstinence syndrome or rebound syndrome, which you can also get with some blood pressure medications. So this isn't just an antidepressant thing. So no hate comments on that, please. Which brings us to number 5. What are the side effects and those drug interactions? Well, all medications have side effects, so don't be hating on me either here. But most commonly with Vilazodone, you'll have the diarrhea, nausea, and headaches. However, just like all the other medications that act on serotonin, it's your body adjusting to those levels of serotonin being modulated or being regulated. And once your body adjusts to that, those side effects will typically go away. And though there is a risk for sexual dysfunction in about 2 to 4% of patients who take this medication, that is a lot less than the standard SSRI or SNRIs, which have up to about 50% of patients that report that side effect. So one of the many advantages of Vilazodone is that it not only works quickly, but it can also be used for patients who have sexual dysfunction with other antidepressants. They can be switched to Vilazodone to avoid that. And in researching this medication, I found a couple of brief articles that talked about a rare occurrence of acute pancreatitis. So keep that in mind as well. If you're experiencing severe abdominal pain and you're taking Vilazodone, then you should probably seek medical care. And so when we're talking about drug interactions, we have to be careful when we're using those antidepressants, the MAOIs, because they stay in your system very long term. And so Vilazodone should be stopped at least 14 days before starting an MAOI, or started 14 days after if you've just come off of an MAOI antidepressant. It should also be used cautiously with other antidepressants. So if it's being used adjunctively, which I would not advise, but if it is being used adjunctively, then you need to be careful for serotonin syndrome, which I do cover in the video that I did on antidepressants. If you want to check that out, it's timestamped under the rare and dangerous side effects section of that video. However, if you would like me to make a separate video on serotonin syndrome, just let me know, drop it in the comment section below, and that video will be coming your way. Now, risk of bleeding may also be a factor with antidepressants, and this includes Vilazodone, as SSRIs typically have antiplatelet properties. So if you're taking a blood thinner with Vilazodone, then you're going to watch for signs of bruising or internal bleeding, and make sure that your doctor is aware that you are taking Vilazodone if you're also on a blood thinner, and this includes aspirin. Also, Vilazodone is metabolized by the CYP3A4 substrate. So if you're taking any inhibitors or inducers of that substrate, it's going to require dosing adjustments with Vilazodone. So remember, inhibitors will inhibit the metabolism of Vilazodone, causing higher levels of Vilazodone in your body, which can put you at risk for increased side effects, and so the dose will have to be reduced. Inducers of that substrate are going to induce the metabolism and therefore making Vilazodone metabolize more quickly, which means you would require higher dosages of Vilazodone if you're on an inducer. And now these inhibitors or inducers are the most common that I see in practice with the CYP3A4 substrate. However, there are many other medications that are inhibitors or inducers of that substrate, so always make sure you talk to your doctor about all your medications that you're taking, including supplements. So those are the 5 things that you should know about Vilazodone. Is there anything else that you would like to add to that list? Go ahead and put that in the comment section below. I'd love to hear about it, and we learn from sharing each other's experiences. And if you have another video topic that you would like me to discuss, drop that in the comment section as well. I thank you all for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you next week.